Hi friends, this is Dr. Ravi Kampale. I'm an infectious disease, wound care and obesity medicine board certified physician who has interest in removing barriers to healing. And I wanted to talk about personalized nutrition, food tracking, and different approach to delivery of healthcare by removing issues that our patients are facing. And this is my attempt at my own trial at how I try to do this for myself, and I'm trying to see if I can make sense of it in this presentation. As always, conflict of interest. I don't have much except removing barriers to healing for infections, wound healing, and obesity. But also, I happen to be an investor in the startup company called fruitstreet.com, which I have used in this presentation, along with a few other tools that I have used. And I do promote an understanding of wearable devices in healthcare delivery. So the problem we have is huge, and according to CDC data, the percentage of adults over 20 with obesity is around 37.9%, and people who have obesity and overweight, and also in people who are 20 or older, is around 70.7. So this is from the CDC data, and I'm not even counting the children who have had significant problems in this process. And economic burden of diabetes has increased on US healthcare, and cost of diabetes is in 2017 was around $327 billion. That is 1 in 4 healthcare dollars in US is going towards diabetes care. And basically the prevalence and has increased a lot, and economic costs of diabetes has increased a lot too. And as per the Millikan report, initial around 1962, our obesity costs are around the obesity rate with economic impact, it was around 13.4%, and that was the healthcare impact on obesity. And basically it has increased exponentially over time, and it has now become around 36.4%, and it has gone up to $1.42 trillion. As seen in this graphic there, of the $3.2 trillion that US healthcare is, $1.4 trillion is US healthcare costs. And basically, as you see here, it is gone up so much that the obesity is impacting a lot of healthcare outcomes, including problems with hypertension, chronic diseases, including back pain, diabetes, colorectal cancer, prostate cancer, Alzheimer's. So all these are nothing but impacts of obesity on healthcare. So if you see, 1 in 4 US adults are diabetic or pre-diabetic, with also all this US healthcare expenditure, like I said, is costing around, because of chronic diseases and diabetes, is costing around 17.8% of GDP, with US military costing around 3.4 or 3.5 GDP, and the healthcare cost is around 17.8% of GDP, with 75% of this being caused by chronic disease, with diabetes, heart disease, cancer, and stroke being the major part. So the major problem that we are facing in healthcare now is diabetes and pre-diabetes along with obesity. So how do we take care of it? We talk about healthcare and healthcare changes and problems associated with healthcare, and the costs of healthcare that is exponential in our country and across the world. So what I've tried to understand is, in removing barriers to healing, what is the main thing that I have faced is around 75% to 80% of my sick care patients are do have underlying problems with obesity. And what is the real cause of obesity is food. And food is information that we give our genetic heritage. Whatever the genes we have, the food becomes something called as epigenetic factor that helps with genetic expression of how our genes behave and the chemicals that are created because of it, and it affects our immunity, our gut, how our gut bacteria become and behave. And this gut bacteria is going to be a huge thing in the future. And obviously we do have other issues, including inflammation, that is very much the real underlying cause for healthcare. And obviously our food impacts our muscle mass, and our muscle mass impacts how long we live. So what are the strategies we need to implement to improve healthcare through nutrition? Is by, it has to be beyond healthy cooking, and it has to have it is to be recognized as the foundational importance in social connection, but also social behavior. And also healthcare has to go from sick care to well care, and also we have to incorporate the issues of mindfulness and also using personalized nutritional approach. And that is what I'm going to try to show in this presentation regarding how I have personally changed myself using this ideology and thought process. And I hope to convey this in this presentation. And this needs nothing but a holistic view and also significant behavioral change in the person who wants to change his health. Approach this include that we need to understand that there is no certain thing as a perfect diet. No certain diet is perfect. We try to say, there are different kinds of diet, Atkins, paleo, all fruit-based diet, and all the different diets that are promoted. But the idea is that none of the diets are perfect. We have to get away from the mass medicine mania that we are going through, like say using studies for 300 or 400 people and telling that this is effective against all the other population. Like we have done this lipid trials and try to come out and say that, all the lipids are useful for everybody. No, they have a small role, but not real big role. And also the same applies to other aspects, including trying to say that we have a nutritional pyramid, and this pyramid, eat accordingly, eat more grains and all that. And or this mass medicine mania, that M3 medicine that I talk about, has to change. And how can we do this is by using nutrition and using food as medicine approach, and that would help our better our genetic expression, because it's our genes that stimulate the hormones that we have, and the microbial makeup that changes. So each one of us are different, hence we need that personalized approach. Now what I've done is I've taken wearable and food tracking devices to try to see how I can come up with this concept and express this idea. So as I talked to you about Fruit Street, this is one of the food tracking tool that is used for diabetes prevention program in the country. And as I told you, I'm an investor in that company, and full disclosure there. But I like to use mobile devices, as mobile devices are the wave of the future, and everybody carries this. This can be the tool of change that we have. And food then tracking devices like any tracking device. Here I have used Fitbit, and also I've used a continuous glucose monitor, as you're seeing on the screen with Freestyle Libre. And also I've used a ketone tracking device that helps with me monitoring my state of what I call it as nutritional ketosis. We can talk about this nutritional ketosis in a separate presentation, but here I've used these four in coming up with my idea of how we need to effectively change healthcare. But this whole thing is possible not by a single person. Single person cannot achieve much, and maybe he can help himself. But for the exponential and impactful change in healthcare, it is team-based approach that is very much important. So what I've done myself is I've started recording my food using the food tracking tool that you're seeing on the screen. And when I and as I did that, as I take pictures, and we take the monitor with the continuous glucose monitor, then I'm able to track my glucometer reading that you're seeing here. And then basically prior to me eating anything, I blow into this continuous glucose monitor, and that tells me what state of nutritional ketosis I am in. And that then as I record the food, then my dietitian is able to give me thumbs up and thumbs down. Where here I've done a small experiment on myself, and I'm going to show this, wherein I have carb challenged myself every week for 4 weeks, and I have tracked that. And here you see the foods that I normally eat look like nice green eggs, vegetables, and all this. But when I started doing the carbohydrate challenge, I have eaten this carb-loaded Indian food. I mean, I love them, but they don't love me. But for this experiment's sake, I really enjoyed them. But I see how dramatically they have affected my own glucose, is you'll see here. And this is the continuous feedback that my dietitian gave me with the thumbs down of the carbohydrate challenge that I have given myself. But here, on the next few slides, I show you how my glucose responded. Immediately after my glucose challenge, my my continuous glucose monitor showed that my glucose has gone up from 95 to 140, and within 30 minutes it went to 150, and within 45 minutes my keto numbers have come down from 7 to 4, and and glucose levels has gone up to 164, and within 60 minutes, that is within 1 hour, my glucose reading, continuous glucose reading, has hit the highest of 176, and my ketone numbers have gone down to, breath analyzer has gone down to 4. And again, within 90 minutes, my glucometer reading has slightly started dipping down. So after I hit the highest in 1 hour, my glucose reading started going down. The 176 that you saw earlier by 1 hour almost puts me into a pre-diabetic range. But since I am well adapted and my insulin started secreting up, and then my glucometer reading continues to go down. So as you see here, by 120 minutes, my glucometer reading is 160, and in 2.5 hours, my glucometer reading has gone down to 124, and by 3 hours it has come down to 124, and in 3.5 hours it is 130, and after 3.5 hours, and I had to hit the bed, and I said, this is what anybody would do. So I was very much sleepy, so I went to sleep. But after 5 hours, once I woke up, my ketone readings were 3, and my continuous glucose monitor reading was 116, and by 7 hours post carbohydrate challenge, finally my glucometer reading came down to 97. So it took me 7 hours, it took my system, my metabolic system, 7 hours to normalize my glucometer readings. That is the blood in my glucose that normally is around 5 grams anytime floating. For my insulin, it took around 7 hours of struggle for it to bring it down. So that is a lesson to myself, teaching myself that, okay, I better be ready to give my system that much of challenge for my glucose to come down. So I have to be careful. I might love the food, but the food does not love me back. So this is what I wanted to show. If you see here, I track my weight, and I track my the ketone in my breath analysis. Normally I am in the 6 range, but whenever I was doing the weekend challenge, my ketone numbers came down and my weight went up. So it tells me that whenever my ketone, I'm not in a fat adapted ketone based metabolism with nutritional ketosis. When I'm not in that, I end up gaining weight. And here is the continuous glucose monitoring that it shows here, where my glucose reading went up to 176, and it took all this time from around 2:30 till almost 9 p.m. For my glucometer reading to come down. And here is the with the weekly carb challenges, this Fitbit recording of my weight. You see that I've gained over the 4 weeks period. Every week when I went off nutritional ketosis and and gave myself this carb challenge, I continued to gain weight of 5 to 7 pounds. And whenever I went back into nutritional ketosis and some intermittent fasting, and also sometimes I did 24-hour fasting, I lost that weight. And but this is what happens when you do carbohydrates, and this is an example, for personalized example for myself not to do it. And why did I do this is because of my own genetic inheritance, where I had this particle called LP little, which is a lipid particle that increases my risk for brain aneurysms, which I do have a family heritage of. And I did my blood test, and I have 2 genes that carry that. But now I had to think about it and understand why and how I can prevent that genetic expression. So I found out that this LP little a is associated with increased brain aneurysms and hypertension, which I don't have. And luckily I did testing for myself for brain aneurysms. I don't have it, but I had to prevent the expression of that. So I decided that I was having problem and I need to take care of myself. This is after 15 years of being an actively practicing board certified infectious disease and wound care doctor. That's when I got into obesity medicine, tried to learn a lot about it. And then that changed me personally, with me losing my body habitus with the gut fat that you see here. I've lost it, and a lot of change, including my facial appearance, and everything has changed. And I average around 175 to 180 pounds right now. So my target is still 170 pounds, and I'm struggling towards that. So here is another thing that I wanted to show. Data is everything, you see. Once I started tracking myself in 2014, I did fasting insulin levels that were higher at 17.7. And over time, if you see, my insulin levels have come down. And also an important thing that I've wanted to share here is the triglycerides have gone down from 164 to dramatically over time. These are all fasting blood sugars, blood testings. And you see my triglycerides have gone down from 65, 75, 69 to 85. This is different times over years. But the major thing I want to show is also the HDL, which they say, oh, there's nothing to correct HDL. But what you can do is you can approach this with the nutritional ketosis approach. I remember my HDL in the past was around 28 too at one point. And since I started tracking, it is around 36, 39, 48, 48, 58, and 52. So it is an actively changing number, but you see the averages are increasing over time. But with this low carb nutritional ketosis approach and healthy fat lifestyle, what I found is my cholesterol, which was 187, which normally people would say is normal, has gone up and has become 256. Now people will start and want me to take Lipitor, which is not right, because there's a total discussion, and we can talk about that separately. But here I can just say that my LDL particles are increased, and the size of them are also increased. So the theory for this is, in a state of low insulin and low triglycerides and high HDL, the LDL and the cholesterol that increases would not matter, because I am now in a state of what is called as fat adapted state. So the cholesterol particles are larger, and cholesterol particles by themselves don't cause the injury, and they are there to repair if there is an injury. So you would see that happen when people take the veins and replace it in a bypass surgery. The veins that are normal then end up secondarily getting injured. So it is the trauma, or it is the inflammation, it is the not so good nutritional lifestyle that the people lead even after bypass surgery that leads to their bypass grafts getting clogged. So the idea is that we have to take care of inflammation, which is very much really needs to be tracked. High C-reactive protein, if you see, for me in the past, the high C-reactive protein was 3.8, and it has come down to 1.7 here in end of 2018. So that's very much important too. So that said, I also did my coronary calcium score, which is 0, and also I did the ratio is very much important. Basically, the triglyceride to HDL ratio, that has to be 5 or less, and ideally less than 4. I guess I got to target more and work on it. But then the most important thing is triglyceride to HDL ratio, which has to be less than 2. And here I achieved that target of 1.6. And the insulin, that has 17.7 in 2014, has come down to 6. So the less I stimulate insulin, the less the inflammation. And how did we go about achieving this for myself? For me, is trying to target and understand my own genes and my own genetic heritage, using appropriate food, and using my own food as my information to my genes. I was able to then change my genetic expression, and also, as much as I would want, this is more of a lifestyle thing. So I need to more increase my time for exercise and sleep a little bit more. And normally I take 6 hours and I feel very rested, but maybe 7 hours or 8 hours might not be a bad idea, and I need to work on that. And basically, for the better genetic expression of my own genes, it is the environment and lifestyle that makes that impactful change. So this is what I talk to my patients when I talk to them about disease processes and how to change themselves so that they don't have to go through the revolving door of my clinic. So cost apart, the problems in healthcare are many. I mean, like, we need to be able to communicate this whole process to our patients, and communication and really listening is a major part of this communication, trying to understand where they are coming from, how their troubles, and maybe distance is a transportation issue. Maybe the health systems have to devise telemedicine solutions that change this distance and prevent travel. And also ease of communication using telemedicine technology is one thing. And we should be able to personalize a solution for the patient, help them realize and not just blame them as not following the direction given by doctors, and help them implement the change and maybe impactfully reevaluate their change and reassess themselves. Hopefully be there as a guide, like a coach that helps big league players perform even a lot better. So that is the analogy that I like to give. And for this effective treatments, there is several critical components, but nutrition is the major limiting step. And we need to have a planned, tailored goals and meet the needs of the patients, and have this lifestyle change the patients so that they can use that lifestyle methodologies to effectively keep their weight, which is the baseline for all these healthcare problems. We can go and talk about costs, we can talk about everything else, but without fixing the underlying obesity and diabetes, we are like dogs chasing our own tails, never getting to it. And we should be able to help people with, say, sometimes use weight loss medications if it is needed, but food can be used to reduce the appetite, which is what I am into. And we can reduce food cravings, and because the same pathway of drug addicts get addicted is the same pathway that food addicts are addicted to. And we need to devise some long-term strategies and maintenance plans for helping our patients and our general population overall in US and across the world. And the treatment of obesity needs treatment of diabetes, and all these problems need a comprehensive approach, which not a single person can do, but systems can do. And with innovative leadership, we can make this happen. Innovative leadership in healthcare, innovative leadership in political arena, and determination just to do nothing but remove barriers to healing. so that we can achieve a goal that is purposeful for all of us in this humanity. The greatest medicine of all is to teach people how not to need it, and that's what I'm into. And as physicians and as healthcare providers, we need to educate masses not to take medicine but use food as medicine. And we cannot solve the problems we have in healthcare by the problems by the way but that we have used the food until now as a wrong methodology. And we have to be the doctors that deliver solutions in healthcare with nutrition as an approach. And healthy citizens for all the countries are the greatest asset. And we, as healthcare providers, have to bring that to the front and use healthcare solutions for making impactful change and exponential growth, and to reach the purpose that we have been created in this world. Please feel free to reach me at my Twitter handle at Wound Physician, or on my LinkedIn if you have any questions. And if you like it, also I'm going to post it on my YouTube channel. Thank you very much and have a great day. Thank you.